All right. So for the next 45 minutes or so, we're going to do a training on the new COVID-19 safety plan. I just want to start out by saying that this is comprehensive. There's a lot of content here. So please take time to review it by yourself before you train your staff on it. The document is about 8 pages. It covers pretty much everything we could think of to make sure that employees, participants, volunteers, contractors, board members, anybody stepping foot onto our sites or being served by us is going to be as safe as possible during this public health pandemic. So you'll see that this document is broken into 4 sections. The first section is employee, volunteer, and participant social distancing protocol. This document we've already trained folks on, and this was the very first step we needed to take when we started modifying our services. But just to briefly go over it, this was the section about self-screening from home. There's more details in the second section about self-screening for employees, but this is general guidance, and all folks, not just employees, but volunteers and participants are required to adhere to all of this in order to step foot onto a VC site or work with any participants in the field. So I'm just going to breeze through this section because we've already gone over it. We're going to jump to face-to-face contact protocol. So this is really where all of the new protocols are in place. A lot of folks probably haven't seen some of these, or if you've been on the various safety committees or working groups, you've been a part of putting these together. So this section is all about face-to-face services. So it breaks down into field-based services, individual services on site, group services on site, etc. So starting with number 1, face-to-face services in the community. Already next week, we're going to be lifting restrictions for working with folks in the field. For our Mariposa program, our Avenues program, our Family Partnership program, and then site-based for our literacy and for our CCSP program. So starting next week, these folks will already be using the self-screening tools we're going to be discussing. The first thing that employees and volunteers are going to need to do is a comprehensive self-screen of symptoms before meeting with participants in the field. What you're going to see, and we'll be talking about shortly, is if you're coming to a site before meeting with the participant in the field, you're going to be screened before entering the site. The screening is going to consist of a thermometer and a questionnaire. If you're going from your home to a participant and you're not going through that screening, you absolutely need to do the employee and volunteer self-screening tool. Can everybody see this document?
No, it didn't change.
Nothing's changed.
Okay. Just give me a quick sec.
Yes, there it is.
So this is the employee and volunteer self-screening tool. You will go ahead and complete this yourself. You don't necessarily need to do the check boxes. You don't need to turn this in, but we are making sure that folks are completing this. So you go through it and it tells you explicitly what to do if you mark yes for any of these.
Are you going to send out these documents as well?
Yeah, they're already sent out and they're going to be uploaded onto the staff resources page.
Oh, I see. Yeah.
Mm-hmm.
Thank you.
Yeah, no problem.
Sean, is this we the staff fill this out
Yes.
for the participant coming in?
No, we do this for ourselves.
Okay.
Before meeting with the participant.
Okay. And there is a participant one.
Yes, the participant is room and number 2.
Okay.
So,
and it was was that made in Spanish as well?
It's supposed to be in Spanish by Friday
Okay,
or Monday at the latest.
thank you.
Yes, thanks for asking. So what we just found out is opening these, for some reason you guys can't see them. So that's a bummer. Let me try modifying my screen share. So hopefully that will change. Okay. So for number 2, if feasible, employees will ask participants to self-screen before meeting for a face-to-face service using the participant self-screening tool. Additionally, employees will self-screen participants upon meeting in the field. So this is a 2-step thing. First step, if you're going to meet with the participant, contact that participant before you meet with them. And you go over this screening tool. Can you guys see this?
Yeah.
Okay, great.
That time.
So participant self-screening tool, before meeting with your VC, CC staff person, please check in with yourself. So you could either send this to them, make sure they have a copy, or you could do this over the phone. So it's very similar to the employee volunteer self-screening tool. So the ideal process in what we're asking is to get a hold of your client the day of your appointment if possible, and ask these questions over the phone before you meet with them in person. Now, I completely understand for some folks that's just not going to be possible, and that's why we have employees screening participants upon meeting in the field. So you have 2 options when you meet with them in the field. The first option is you bring the participant self-screening tool, a hard copy, and when you meet with them, you ask them that, or you just do a general screening where you ask them the basics. Have you been sick? Are you experiencing a cough? Are you experiencing a fever, etc.? I recommend bringing the self-screening tool so you actually know what questions to ask. But the idea here is, 1, we're not going to be able to screen everybody over the phone before we meet with them. And 2, sometimes an individual might screen well in the morning, but then when you meet them in the afternoon, they might start showing symptoms. So it's important that we do that upon meeting with them. Number 3, employees and volunteers will never enter the residence of a participant. That's always been our protocol for the most part across the board, and that's critical right now. So we'll get more into what a safe meeting place looks like in the field, but it is absolutely not inside the residence of a participant. Employees are required to wear face covering when working directly with participants in the field at all times, unless otherwise directed by public health. Employees should complete the checklist for face-to-face services prior to meeting with the participant or community member. So the idea here, because there's so much new information being disseminated and there's a lot to remember, I created this checklist for folks to go through. So before meeting with your participant in the field, go through this checklist just to make sure you got everything covered and you're going to be meeting with that person in a safe way. Number 1, you called the participant and completed the participant self-screening tool, which is what we already went over. 2, completed the employee volunteer self-screening tool, which is what we just went over. 3, I informed the participant that a mask is required for us to meet. So that's a part of the participant self-screening tool. I just wanted to make sure to add it in here too, so it's explicit. I informed the participant about our safety protocols. So while also talking about the mask requirements, let them know in advance, because it's going to be really tricky to remain 6 feet apart. Absolutely no touching. Face covering must be worn the entire meeting, not just on our behalf, but on their behalf, and informing them that their hands should be washed before and after the meeting. What I also recommend is just having a frank conversation with them and letting them know this is difficult. We understand this is unusual. And if these are in any way not complied with during our individual meeting, we are asked to leave. It might come up for some folks where you're in the middle of session with a client and they decide they don't want to wear a face mask anymore. In that time, you'll have to inform them that you'll need to leave unless they put the face mask on. Any questions regarding that? Oh, and then I have my safety kits, mask, hand sanitizer, gloves, etc. So for the programs that are starting field-based services next week, Maria and Jan put together safety kits that they're going to be giving. It's your responsibility to make sure you keep your safety kit safe in a place that you won't misplace it or it won't be stolen, because our supplies are definitely limited. And you're welcome to make your own safety kits if there's additional things you'd like to put in there. We are going to make sure to have masks in case you show up and a participant's not wearing a mask. If you give a participant a mask, obviously you want them to keep the mask. We're not going to ask for it back. Hand sanitizer, gloves in case you or the participant want to wear the gloves, and then any other safety items you'd like. Lastly, during your phone call, identify a safe place to meet. We're going to see in the safety plan different suggestions of safe places to meet. Unsafe places are any shared spaces where there's a lot of contact and there's no control over the environment, such as entering somebody else's house, and where 6 foot distancing is not possible. So we'll get into that briefly. So if you're going to be providing field-based services and you're doing this step-by-step, step number 1, open up this document, the checklist for face-to-face services. This document is going to guide you in what you need to do before meeting with the client in the field. Eventually, we're going to get in the rhythm, and we're not going to probably need to consult this every time. However, this is critical. So for at least a month, it's going to take us looking at this each time before we meet with the client. Any questions there so far? Okay. All participants must wear face masks when meeting directly with employees unless other, okay, I already touched on that. Employees will utilize hand sanitizer while working in the field. It is recommended to use hand sanitizer after touching any community shared surface, before putting on or taking off any face coverings, and before meeting a participant. So if any of you have gone to a grocery store lately and you're bringing hand sanitizer, I don't know about you, but I will use it 3-4 times sometimes while I'm in the store. And it's the same idea. If you are in a community space or you decide to meet at a public space where you have to enter inside, but there's a safe place inside, when you touch that door handle, you might want to use hand sanitizer afterwards. If you're going to be adjusting your face mask in any way, you might want to use hand sanitizer beforehand. So by us being educated and practicing these skills, we're going to be able to share them with the participants that we're serving. This touches on the cleaning kit that was in the checklist. One thing that'll also be in there are pens, because we may need folks to complete paperwork when we're meeting with them. In those cases, it's best to just give them a pen. So we don't need to keep these pens. We can give them a pen and ask them to keep it. It's just the safest practice. And then here's the safe environments I was talking about. The first piece is open and ventilated spaces. You want to stay away from any space where there's no fan, there's no open doors or open windows. You really want ventilation. So even meeting outside in a safe environment works for this. These are all examples: parks, beaches, a driveway, sidewalks, outdoor sitting areas, parking lots, etc. The space needs to provide at least 6 foot distancing. So any space where you're forced to stand or sit within 6 feet of the individual is not a safe space and does not require touching of any shared surfaces. So this includes benches at parks, public restrooms, etc. Now, I do understand if you go walk with the participant in a park and then they choose to sit on the bench, that is their choice. But your responsibility is to not sit on the bench next to them. Employees must end face-to-face services with the participant if social distancing requirements are not being met or if symptoms are present. So if you show up and your participant is coughing nonstop, unfortunately, you'll need to leave, even if that participant claims that it's allergies or something else. I know this is going to be uncomfortable for some of us, but this is critical. Any questions so far on the protocols for face-to-face services in the community?
Yeah, I have a question about the self-screening.
Yes.
So you had mentioned that if we leave from our home, then obviously we have to, we need to self-screen before we get to that appointment. So if we have several appointments in one day, do we need to self-screen each time before each appointment?
Melody, that's a great question, and the answer is no.
Okay.
So if you're an employee walking into one of the VC sites, you're going to be screened upon entrance. You're not going to be screened every time you leave the site and come back in.
Okay.
Although the only thing to keep in consideration is if midway through the day you start developing a cough or you start showing symptoms, then it's your responsibility to cancel the rest of your appointments and quarantine at home. But you don't need to continue completing the checklist before each one.
Okay.
Just once at the beginning of the day. Yeah, great question, Melody. Any other questions on face-to-face services in the community?
Yeah, I've got a question. So I know for employees, we have that 7-day quarantine time once we start to show any kind of symptom.
Yes.
Does that hold true for participants as well?
Yes, it does.
Okay.
We'll be getting into that. There's guidance in the health screening form that we'll be going through later in this presentation, but it's the exact same.
Okay.
At least 7 days of onset of symptoms, including 3 days of no symptoms.
Okay.
Great. All right, so now we're going to jump to individual services. So these are services that are in the field or site-based. They're just individual services. Primarily site-based, actually. Let me clarify. First, all individual services must adhere to social distancing requirements, including 6-foot distancing, wearing a face covering, and located in a safe environment. 2 designated rooms will be set up for individual services that include hand sanitizer, tissues, and a trash can, ventilation, 6-foot distancing between chairs, and designated place for used pens. So Crystal is already going to be opening the site for CCSP services next week. And what she's doing over at 17th is she essentially developed a little kit that has the hand sanitizer, tissues, etc., that she's going to be bringing into the safe office space where they're going to be providing one-on-one services. So if you have a shared building, that's fine. If you have a designated space in a building such as Carr Street or Harvey West, you can just leave the items in that space if you'd like. Ventilation it's further explained in here in the site protocol, but essentially ventilation is a fan and window preferably. However, just one of those is needed. We're going to be providing fans for every designated individual counseling room, by the way. So everybody will have fans in the designated counseling rooms. And then a designated place for putting the used pens that participants will be using. Employees and participants must wear face covering for the duration of the service unless otherwise directed by public health. It's going to be uncomfortable, I understand. It is going to be a whole new experience, but it's something that we're going to need to get through together. So if you're inside, you're meeting with the participant, masks have to be on. If a participant chooses to take their mask off, they'll be asked to leave the site. Any questions on individual services before we move to group services? All right, group services. All group spaces must adhere to 6-foot social distancing requirements. Group spaces will be limited to 6 people per group unless fewer people are required. So as of now, even if we deem a space can have more than 6 people, we're going to limit it to 6 people for now, unless fewer people are required, such as the group room at Mariposa. It's just impossible to have 6 people all maintaining 6-foot social distancing in that space. So fewer people will be the max requirement. So for now, we're limiting it to 6 people max. This will change as we move about, and these safety protocols are more familiar with all of us. Same as individual counseling room, hand sanitizer, tissues, and a trash can will be included in all group counseling spaces. Staff and participants will wear face coverings for the entire duration of the group. Participants refusing to wear face covering will be asked to leave this site. Shared surfaces must be disinfected before and after all groups. So this is going to be a change management piece for us. If you are responsible for facilitating the group, or your staff are responsible for facilitating a group, it is their responsibility to disinfect surfaces before and after groups. If you know that space has been disinfected because janitorial staff disinfected it the night before and nobody has touched it since, you do not need to disinfect before. However, after each group, you must disinfect all shared surfaces. This will not be just for janitorial staff. This will be for all direct service staff. Participants will be encouraged to wash hands before attending a group. So if you have 3 participants, they're all coming in for a group, you're going to ask them to line up 6 feet away from each other and wash their hands for at least 20 seconds. Group rooms must be properly ventilated. So this is where it clarifies at least 1 fan and window open. Any question on groups? Please note we're not starting these yet. Our earliest start date for any group service is going to be at least 2 weeks from now. Okay, so now public. Public consists of all volunteer. The public consists of scheduled staff, deliveries, volunteers, participants, contractors, and partners. So all volunteer center facilities are open exclusively to scheduled staff, deliveries, volunteers, participants, contractors, and partners engaging in scheduled services with either appointments or scheduled walk-ins. Individuals agree with wearing a face covering, maintaining 6-foot distancing, signing in at the entrance of a VC building before entering, and passing a health screen before entering a building or meeting in public. So we'll be getting into the health screening piece shortly. This is just what's required for any member of the public to enter a VC site or be served by us. Face-to-face meetings and access to VC sites will be denied if an individual does not comply with the required social distancing requirements. So I just want to pause for a moment to talk about this piece. We'll be touching on it again in a little bit, but I can guarantee we're going to have a participant or a community member or a volunteer or some member of the public not want to adhere to one of our social distancing protocols.
Yeah.
However, they're going to want to come onto a site or they're going to want us to serve them. And so that's where it's really our responsibility to be patient and to educate folks, because it's really unfortunate. It is unfortunate to be suffering, to want support, but not want to put a face mask on because you have some sort of paranoia or some sort of difficulty wearing a face mask. It's going to be hard if you're suffering, you want to go in and you have services, but you are terrified of somebody doing your temperature, right? These are something that I know Community Connection are going to face and that I imagine other programs are going to experience too. So this is a space where I really want to make sure you pause and you work with your staff when you're doing this training with them. And if you all recall, we did a crisis more working with people and dissolving difficult problems training about 6 months ago or so, and that information is actually up and available for everybody. So you could always consult that. But really, I think step number one is just acknowledging how difficult this is. If you have somebody who's outright refusing, rather than going into policy enforcement mode, it's a really important time to just take a moment and say that we understand. We understand how difficult this is. We've probably been in a similar place where we've had to go to a grocery store or someplace and we realize we forgot a mask. It's enraging. However, it is important for our safety and for their safety that it's adhered to. So start with understanding. Understanding typically diffuses, and then just laying out the policy. We would love to serve you. We would love to have you come in. However, we have to adhere to safety protocols. They're not our choice. They're mandated by public health. Any questions on that piece? All right. Common areas will only be available for designated individuals waiting for appointments. All common areas will be closed to the general public otherwise. Essentially what that means is if folks are coming for an appointment, they're done, but they just want to hang out in a common area, we're going to have to ask them to leave. For two reasons. One, we have capacity limits for specific rooms. So for example, for 17th Ave, there is a capacity limit. And if we are letting folks that are waiting for appointment know that they have to wait outside because there's another individual who just wants to hang out in our space, that's not going to work. So we got to make sure that folks that are in shared spaces are in there for a reason, and if not, we have to discourage loitering at all costs. And this also includes us. This also includes volunteers. So if we're just hanging out in a common area, we probably shouldn't. We should minimize our contact in areas that other folks are going to be having contact with. Okay. Volunteer contact. So all volunteers must adhere to social distancing requirements as outlined in the section VC social distancing protocol. So that was on top and already previously distributed to everybody. Volunteers will perform a self-screen for symptoms related to COVID-19 before performing any volunteer tasks. That's redundant. It was already stated above, but I just wanted to make sure that if folks kind of skip to a specific section, things are restated. So the employee volunteer self-screen document that we saw at the top pertains to volunteers here. Usage of face covering, gloves, and hand sanitizer are recommended for off-site duties such as grocery stores in accordance with public health guidelines. Volunteers must refrain from shaking hands or touching other people while performing a volunteer duty. Pretty straightforward. Any questions about volunteers? Okay. Number 6, transportation. I want to start by saying as of now, we are not transporting any participants in vehicles. Starting next week, if things are in place, the only program that we are allowing to transport individuals is the Avenues program. So that is off limits. There's a lot of complexity in driving a participant. So transportation, we'll see that, but also this is for any folks using company vehicles. So I know we're using company vehicles for food distribution. If we have to meet with the participant in the field and we just do not want to take our own vehicle and we want to take a company vehicle, these are protocols we need to adhere to. There's going to be a safety kit in each vehicle. Maria has already distributed those safety kits, so they should be in each vehicle. Drivers are responsible for disinfecting all shared surfaces after use. So if you're done using it, you need to sanitize the door handles, steering wheel, radio, all levers, and any other thing that you touched. Drivers will perform a health screening of participants before allowing access to a company vehicle using the participant self-screening tool. So this is when either one, we start driving folks again, or two, for avenues. If avenues is going to start driving folks, you need to screen before they're allowed in the vehicle, even if they're all in quarantine in a shared space. Drivers must ensure all passengers wear face masks and adhere to social distancing requirements. This includes a driver wearing a face mask. If 6 foot distancing is not possible, plexiglass or other protective barrier must be installed in the vehicle prior to transportation. So for the Avenues van, until we have what we're using as a sneeze guard installed, we are not to drive any participants. The sneeze guard essentially provides the 6 foot distancing between us and them. And passengers will be encouraged to use hand sanitizer before and after transportation in the company vehicle. Any questions on face-to-face? So these were all under the face-to-face services piece. And we're going to be segueing into site safety protocols if we're all good here.
So this would include no staff, no two staff being in the same vehicle together?
Yes.
I'm assuming.
Yes, absolutely. Thanks for clarifying, Melody.
I know it's kind of ridiculous, but it also means that no participants are in the passenger seat.
Absolutely. Yeah, so that's where the 6 foot distancing.
Right. Just want to be clear.
Exactly. The only way that would be possible is if we did some ludicrous protective barrier with sneeze guard between us and the front passenger, which is just not going to happen. So pretty much a no.
Does this also mean in your own personal vehicle? Like if we're carpooling to Watsonville next week to look at the site there, or should we not do that?
Yeah, so that includes your own vehicle. That is a great question, Crystal. And this is why. When you're driving from site to site, you are working. You're claiming mileage. That drive is considered work. And we are adhering to 6 foot distancing with all employees while we're working. That's something that we absolutely need to enforce. That includes driving with each other. Now, if you have a big vehicle and you have 6 feet between you and another person and they're sitting in the back and you're both wearing masks, that's doable. But yeah. Any other questions about face-to-face? All right, we're going to jump into site safety protocols. So effective for most places Friday, we're going to have health screening before entering the building. I just want to start by prefacing that because 17th is the only site opening for site-based services and they have the most traffic for next week, they're going to be the only site that has staff performing the health screening for everybody walking in. The other 3 sites, until we open site-based services, are going to have a self-screening setup. And I'll get into what that's going to look like shortly. So just hold that in your mind as we go through this. So all employees, participants, and visitors must perform a health screening at the entrance of a VC site using the health screening checklist before entering the building. Okay. It is not wanting to open. All right, give me a second. All right, so here is the health screening checklist. This is going to be at the front of every site. If you are a staff member that is responsible for screening individuals, you will be following this checklist. If you are self-screening yourself at one of the other 3 sites that has a self-screening setup, then you're going to be asking yourself these questions. Can everybody see this document?
Oh my gosh.
Yes.
Okay.
So if we have any of these on here, like a runny nose, wow.
Yeah, CDC just updated symptoms to include those. So individuals must perform the following health screening before entering a VC site. Ask the following questions before performing a temperature check using the designated forehead thermometer. So if an individual responds yes to any of these, then you go straight to here and you do not do the forehead thermometer check. That's a way to just minimize touch. So this is essentially training for the folks that are performing the health screening. So you'll ask these questions. If they are all no, then you move to 2, 3, 4, and 5. If any of these are yes, then you skip to Roman numeral 1 and 2. Does that make sense? Okay, so if any of these are yes, do not proceed with the forehead thermometer check. Inform the individual that they need to leave the site and not return for at least 7 days of onset and 72 hours after the symptoms disappear. So this is in writing here, so the folks at the front know what to say. And then 2, please provide symptomatic individuals with the following. We decided to just have blank index cards for individuals to write their name, contact number, and reason for site visits so program staff can contact them for phone, email, or video conferencing services. It's just when folks are providing personal information on a big sheet, there's a level of, for lack of a better term, paranoia in what that information is being used for. An index card is less invasive, and the purpose of this is just for that program staff to contact that individual. The second resource we're going to give them is a COVID-19 testing resource sheet that shows where they can get tested and who they can call if they'd like. So these 2 are going to be given to that individual if they say yes to any of the above. If they say no, then we continue the health screening. We perform a forehead thermometer check. If a temperature of over 100 degrees may be caused from overheating due to weather conditions, the individual will be asked to stand in the shaded space for 15 minutes before retesting. The individual must retest under 100 degrees twice in order to be allowed entrance to the building. This is going to be really important. The forehead thermometers we have, according to Karen, will give false tests if it is too hot out. Folks can get overheated and can show a temperature of over 100 degrees. If that's the case, we're asking folks to go to a cool place for at least 15 minutes and retest twice. If they retest twice under 100 degrees, then the 100 degree plus is a false test and they're allowed to enter the building. Questions on that one?
I have a question.
Yeah.
For instance, like myself, I'm allergic to oak trees. Oak trees are full bloom right in my backyard, which causes me to have a runny nose sometimes. It is sneezing from the oak tree. I mean, it's not that I shouldn't come to work. So if those oak trees are going to be in bloom all summer, so as an employee, what do you do under those circumstances?
If unfortunately you're showing any of those symptoms, you're going to have to work remotely. And we're going to have to work with you on that. And for 2 different reasons. One, if you are even asymptomatic and you're carrying it, but you're sneezing, there's a higher likelihood for you to be spreading it. And 2, there's really no way to tell whether they are allergies or symptoms. So for something that is prolonged, if there is, let's put it this way, if you or your staff have a concern, then just contact me directly regarding this. I'd like to make it a blanket statement for the time being, because we're going to have all sorts of folks making justifications for why they might be experiencing a symptom or two. I understand it's really challenging. That's just what we're going to need to enforce, though. And I just want to say we're not the only ones doing that.
Do you think people who have allergies and want to get tested could then bring a negative test back and then it not be a problem anymore?
Yeah, we've talked about this previously, and unfortunately, a negative test doesn't reveal much.
Okay.
Because in between the time you took the test and the day that you're back at work, or the 2 days or 3 days or 4 days out, you can contract it. And two, a lot of places are only verifying that you're negative if you have 2 negative tests, because there was a recent publication of, I think it was around 30% or so of faulty tests. So it's really important that you do not rely on that.
But people can work from home. They could always.
People can work from home, yes. We can work on modifying schedules however possible for that.
John, I have a question about the retest of the temperature.
Yeah.
You 2 retests. Is the second retest another 15 minutes, or is it right away, or?
It can be right away.
Okay.
If you retest, you're 98,
All right.
then retest again right away, so
Okay.
you don't start heating up again.
Just wanted to clarify. Thank you.
Yep. Number 3, ask the individual to sign in using a clean pen. So we're going to have a thing of clean pens, thing of dirty pens. So make sure that they use a clean pen when they sign in. And then ask the individual to put the clean pen in the dirty pen pile after signing in. Pretty self-explanatory, but I just want to make sure that we have all the lists written down. Number 4, ask the individual to use hand sanitizer after signing in. At each sign-in site, we are going to have a standing hand sanitizer kind of kiosk, so folks can just use the hand sanitizer before fully entering the site. And
Is
then
that automatic, or do they have to touch it to get the hand sanitizer out of it?
they're going to have to touch it, but they're sanitizing their hands directly after.
Okay.
That would be okay.
5, sanitize all the pens after your shift. So when you're done, we're asking folks to sanitize the pens. Cool. So this is what we have as a checklist for if you're the one performing the health screening or if you're self-screening yourself. So for Harvey West, Carr Street, and Main Street, we're going to have this printed out on the table, and you're just going to look at it and kind of do mental check, check, check. If you're all good, you're going to sign yourself in after doing the thermometer. There's going to be a disinfectant spray or disinfectant wipe next to the forehead thermometer. So after you do it, you need to make sure you clean it.
Sean,
Yeah.
should we have it say on this document, like for the mask, if you don't have a face covering, we just give you one?
Yes. So that's part, I think that's in the safety plan. If not, I'll make sure to add it. But when we have, do you have a mask in order to enter the building? If they say no, part of what we're going to have in the front is a thing of masks for folks. So they can't enter the building, and the mask will be
then
for
you'll
them to
give them
keep.
one and then they'll say yes.
Exactly. Yeah. That's part of the, it's part of the table that we're going to have at the entrance for everybody. It's going to include a thing of masks. Yeah. All right. Any questions on this before we move on? Okay. All right. 1 second. Okay. So safety plan is right here. So we talked about the screening checklist, temperatures taken prior to entry of participants. If a temperature of over 100 degrees may be caused by overheating, we talked about that. Staff performing the health screening must use a mask and disposable gloves. Gloves should be changed between use if contaminated by coughing, sneezing, or etc. We also bought 10 face shields. Those are optional for the folks that are going to be doing the health screening up front. If you are assigned a face shield, that is your face shield. It's yours to keep and be responsible for. We ask that you don't leave it at work in any open space because those can be contaminated, so you bring that with you. And we're gonna be giving folks paper bags that you put the sneeze guard in, or the face shield in.
And when you wear a face shield, you wear a mask also, right?
Absolutely.
Okay.
Yeah, masks are non-negotiable. Face shield is just to cover the rest of your face if you like, but you have to use both if you're using a face shield. Okay, staff must sanitize the forehead thermometer between each use. So you test an individual if it touches them at all, or just for safety, best safety practice, just sanitize it after each use. All employees, participants, and visitors must sign in using the VC COVID-19 sign-in after passing the health screening for contact tracing before entering the building. So this is the sign-in sheet we're going to be using. Can everybody see this?
Yes.
All right. By signing, I acknowledge the following. I do not have a fever or symptoms related to the coronavirus. To my knowledge, I have not been exposed to the coronavirus. I will adhere to VC's social distancing protocols at all times. They're going to put the date, the time, the full name, and then we're going to be writing whether they passed or failed the temperature. The reason we're doing pass or fail rather than their actual temperature is it helps us bypass having to have a specific state notification at the front entrance. So that's what we got. Questions on that? Okay. Down here, it's just more direction for the people up front. So it just tells you what to do if that individual fails. I just wanted to make it as redundant as possible for staff so you know what to say and do if there is somebody who presents a symptom. And again, these are all going to be accessible on the staff resources page on the Volunteer Center website. Okay. Sign-in sheets will include date, time, temperature, etc. Okay, we touched on all of these. This is the notice I was talking about. We're still going to put it on the tables if it's not too big of an issue, just for proper ethics. However, it's not required if we're not writing down the specific temperature. These are specific guidelines on health screening per site. So it just shows you explicitly what we're going to be doing starting next week for each site with health screening. So Harvey West will have an outdoor screening table. The screening table will be indoors while we're doing self-screening. Once it is open to participants and other public members, the table is going to be outside and it's going to be staffed. In the meantime, when you walk in Harvey West, there's going to be a little table. You need to stop, do your own self-screening, your own thermometer check, your own sign-in, and then you can go about the rest of your day. And we have a maximum number of 10 participants in the building at Harvey West currently. 17th Ave, I'm going to, this piece, the classroom max occupancy and community room max occupancy, I'm meant to delete because that's stated underneath. So I'll go ahead and change that. But they have an alternating screening schedule with community bridges at the front entrance. This is Carr Streets and Main Streets. For the sake of time, I'm just going to run through that. This is clear direction on the building signage and directional traffic that we need. So if you're a site manager or admin staff, make sure that your site has adherence to all of these. So for Harvey West, these are the identified shared spaces that are going to be closed for now to participants and visitors. The kitchen will be closed to participants and visitors at Harvey West. So no one but staff can be in the kitchen. Bathroom in the kitchen will be closed to everyone, not just participants, but everybody. We're going to limit the places as much as possible. That gives 2 other bathrooms for staff to use in the meantime at Harvey West. And the waiting room is going to be closed. So please, as a staff member, do not just hang out in that room. 17th, the waiting room will be reserved for appointments only. We already touched on that. In Carr Street, kitchen will be closed to participants and visitors. Computer lab will be closed and the waiting room will be closed. This will be modified as we change that, but for now, this is what we have. Main Street, there's no closures, which is why you don't see it on here. Any questions? We're kind of running through this quick because we're running out of time. This is a lot of content. Okay. Shared surfaces, this just touches on the shared surfaces and our responsibilities to clean those surfaces. First is participant phone. So any use of the participant phone needs to be by appointment. So we'll need to communicate with our participants when we reopen services that there are some changes. One of those is phone. So if a participant just goes to use the phone without asking you, you need to talk with them and let them know that this is a safety protocol they need to adhere to. The reason being is that if we know there's an appointment, somebody using the phone, then we can ensure it's clean before and afterwards. They'll have to also wear a mask when they're talking on the phone. These are the phone locations. The other thing we're doing is all flyers, brochures, and handouts must be behind a screen protector. So no loose articles will be left in shared spaces. So if you imagine walking into a building and you're used to seeing magazines or flyers or brochures on a table, those are all going to be removed and put on the wall and screen protectors. All employees should disinfect shared surfaces before and after use, including keyboards, desk, mouse, phone, copier, etc. Anything that you're touching that's a shared surface, it's best practice to sanitize afterwards. And then bathrooms must be cleaned thoroughly with proper disinfectant at least once daily. Here's guidance on workspaces. We've already touched on this. This is critical if you or any of your staff find that your current workspace does not adhere to 6-foot distancing with another person's workspace. You'll need to talk with site manager, your supervisor right away to arrange a staggered schedule. And we're going to give preference and priority to folks that can perform the regular job functions remotely if they can't have 6-foot distancing in a shared office space. This details our current occupancy max. So go ahead and take a look at this if this pertains to your program or your staff. I'm going to breeze through that. Computer labs. So as stated above, we are going to close Mariposa Computer Labs for now until further notice. However, Harvey West site labs are going to be open for appointment only. We will reopen Carr Street Computer Labs and we have better safety protocol. The problem is proximity with 6-foot distancing to other spaces with the computer labs at Carr Street. However, computer labs at Harvey West, you can maintain 6-foot distancing. They will only be used by appointment only, and the appointments can be made by other programs. So for example, literacy can schedule times to use the Harvey West computer labs. But these are our protocols in order to use those. Any participant that uses a computer lab that doesn't adhere to these protocols will likely be asked to not use the computer lab again. It's really critical that this is adhered to. So if you have a participant who's going to use it, you have to walk them through this protocol beforehand. Any questions on computer lab or anything else we've talked about so far?
If the computer lab at Harvey West is going to be open to other programs that aren't usually at Harvey West, will they also have staff that will do this with them, or is staff at Harvey West to be responsible for these other individuals?
It'll be the actual direct person working with those clients to go over the protocols with them.
Okay.
Yeah. And then we're going to have this printed out at the computer lab so they can reference it. But yeah, it's so if literacy they set up an appointment for a participant to come to Harvey West to use a computer lab, it's literacy's responsibility to sit down and go over the protocol with them, and then just schedule a time that works for us for them to come. It won't be our responsibility to then sit down and go over the protocol with them. We're assuming that that's already been done.
Okay.
Yeah.
But we'll know, so there aren't more than 10 participants in the building at a time. We'll know ahead of time, right?
Yeah, that's why it's an appointment.
Great.
The other thing I was wondering about the other stuff we had discussed was, has the, maybe it's a better question for Jan, has there been a schedule established for temperature checks at the door for health screening? Because I know it's not going to be a shared task between Community Bridges and us. It's going to, since we do ours outside. Has that been established? I don't think she's at her desk. Never mind. Or at her. I don't see her at her computer.
Okay, so just to clarify, Crystal, you guys decided it's not going to be a shared task, that we're just going to be doing it by ourselves the whole time?
Well,
At
that's what
17?
that's what I had thought that was going to happen, since we're doing ours outside and Community Bridges is doing theirs inside. Jan,
Okay.
did you work that out with them? You're on mute.
Karen, just before I came home to catch this meeting, Karen had said that we'll be sharing it with downstairs. So I don't know if she had a conversation or not, but she said that we weren't doing it outside, we were doing it inside, and that we were sharing the responsibilities with downstairs. So I need to follow up to see if she had the conversation or not. And that's
Okay.
different than what we all had talked about.
So communicate with me as soon as possible with whatever you guys identify so I can update the safety plan.
Yes.
Great, thank you. Cleaning schedules. I just ran over the group meeting piece because this is all redundant with what we've already discussed. This is just specific to the site. This is the cleaning schedule. We are ensuring that every site is cleaned every day, with the exception of Main Street because they're only in operation 3 days. The sites need to be cleaned either before program hours or after program hours. So we have Monday through Friday at 17. With Acela, we have Harvey West Monday through Friday with Jack. Carr Street is Monday through Friday with Bernardo. And then most likely Bernardo is going to also do Main Street Tuesday, Wednesdays, and Fridays. So that way we have select folks that are doing an incredible job cleaning the sites. The only thing we're going to need support on is identifying backup cleaners in case either of these folks get sick or need to be out.
Also,
Right.
Bernardo will need keys.
Yes,
Right, yeah.
yes, we'll get there. Awesome. All right, so the last section, you can all breathe deeply. This is critical to supervisors. So this is compliance and training, what our expectations are. All employees must read the safety plan and sign the safety plan acknowledgement form, acknowledging that each employee read and understands the required protocols. Just like our personnel policies, this is something that all folks need to sign, and this acknowledgement form is going to be going in your personnel file. So this is what it looks like. So once you do training with your staff, you're going to have them all complete this form and send it to Lois. Lois will be putting them in the personnel file. It's not Lois's job or it's not my job to make sure these all get done. It's each supervisor's job to make sure your direct reports have these done. This states I have read the VC safety plan and understand the responsibilities I have as a volunteer center employee to comply with all VC safety plan protocols. I acknowledge that I have received training on the VC safety plan and understand the safety hazards of non-compliance.
Sean, I have a question in reference to taking temperatures and the person assigned to it. I have my volunteers who have been with me for years. Are we allowed to let them do that? And do they also sign this because they're actually working in the office with the public?
Yes. So as stated above, everything we're talking about pertains to volunteers. So they will be signing this, and no on them performing health screenings at the moment. We're only going to have staff performing the health screenings up front for a few weeks. Once all protocols locked in place, we're confident in how it's going, then we could have select volunteers come on to do it. The only exception that we're having is if a volunteer is an RN or has medical experience. Unless that, we're just having staff doing the health screening in the meantime. And I'll let you know if and when that changes, Jan, because eventually when we reopen and staff are busy again, then we'll likely need receptionists to be doing health screening. But in the meantime, it's got to be us.
But they can, in the meantime, help sanitize the areas.
Absolutely. Yes. Thanks for bringing that up, Jody. The other thing on this is folks taking shifts to do the health screening and taking shifts to do the 12 p.m. disinfectant is not restricted to anybody. So all leadership, all supervisors, all staff are encouraged to participate. So I'll definitely be doing at least one 12 p.m. cleaning at Harvey West. I know Karen plans on doing one at Volunteer Center. So it's really a group effort. So
when will we get a schedule for that? And also when will we get a schedule for health screening? Because I think the earlier the better for the people, for anybody, because we're all busy. So it's, if we can get on it now.
Absolutely. Yeah. Jan's responsible for that one. So that's up to Jan's time. We need it done by Friday. That's the bare minimum.
It has to.
But it'll be a schedule of who's doing what, and Jan's coordinating that one for 17. We don't need to do it yet for all the other sites because we're not going to be having select staff doing the health screening. But once we get closer to reopening those sites, that'll be a responsibility between Jan and Maria to develop those schedules.
Sean, I have a question. Also, Giselle is off on Thursday and she's the one who cleans the office. Would you be sending Bernarda over for the cleaning or?
Yeah, that's a great question. From what Karen shared with me, she cleans before program on Friday and then after program, which substitutes for not being there Thursday. If she's cleaning before program hours start on Friday, there's virtual no difference between cleaning after program hours Thursday and before program hours Friday. So we don't need somebody else doing that. If that changes and that's not happening, then we will need somebody else cleaning Thursdays. But that's the schedule Karen communicated with me. That's been happening under.
Thank you.
Yep. Okay, training will be provided to all staff prior to implementation of the new protocols.
Sean, sorry about that.
Yeah.
So that's if she, okay, so I see she cleans Wednesday afternoon for Thursday and then again Friday morning. And that's why Thursday is exempt.
Yep. Okay. Yeah, that's great. That works. Thanks for clarifying. Training will be provided to all staff prior to implementation of the new protocols, which is why I'm doing this with all of you today. And then the ask is that you do this with your staff by Friday. You could also send this video out to them so they can watch it. And then what is included with the training is having them sign the form. Because this is going live on Monday, we need to make sure folks are in compliance and have an understanding of what we're asking. So please make this a priority with your staff. You can do it over video conferencing like I'm doing. Really what's just important is that you go over the safety plan with them If there's any questions that they have, you answer those questions, and then you specifically talk about things that relate to their position or their work with us. This is exactly what I just talked about. The associate director will train all supervisors on safety plan protocol and create a recorded video training for all employees. Supervisors will be responsible for training direct reports and addressing compliance issues and protocol questions. So this is the piece that's important for supervisors. Compliance to safety protocol will be enforced by supervisors using the safety plan compliance checklist. The checklist will be completed by supervisors weekly until further notice. Originally, we wanted to create a compliance team. That's just not going to be possible, and it really isn't the most effective method for change management. So supervisors, at least for the next month, every week, we'll be doing a quick safety plan compliance checklist. This is what it looks like.
Sean, this is Christina. I don't want to open a big conversation about it, but I did want to know if there's anyone besides me and Crystal that supervises people who work in different sites. So Crystal and I both supervise people who don't work at the same site as us. And I think we can, between us, work out how to do the compliance check for people, but if there's anyone else at Community Connection in that situation that wants to brainstorm with us how to best do compliance checks for sites you're not physically at.
That would be great.
Yeah, and I'm sure it's only going to be for a short time, as we know that Watsonville's looking at relocating, if not combining offices. So,
yeah. So, if anyone wants to, you could just send me an email. If anyone else wants to talk to me about that.
Yeah.
Hey, thank you, Christina. Yeah. I'm in the same boat. And if I can't actually visit the site, I'm going to be calling and asking questions.
Okay, yeah.
So I made this fillable electronically, since a lot of the work we're going to be doing is electronic. And all that I ask is that you send this to me every Friday if there's suggested corrective actions. If not, keep it for yourself, save it in a file. But essentially, you're going to put your program name, supervisor name. If it's for a division, you just put the division. Supervisor name is yourself.
Okay, got it.
And they're checkboxes. So, and they're by section. So section A, you just go through. If there's no compliance issues, go ahead and just click.
Okay. All right. Just call me when you get to the parking lot.
Can somebody mute the background, please? Thanks. So if there's no compliance issues, you're good. Move on to the next. If there are, I'm going to ask that you, anyways, you get the idea. Uncheck that, you check this, and I'm going to ask that you put the number of the protocol. So for example, if it's 1A1, so that way I know what you're referring to. A1 would be A1, employees are not self-screening. Questions on that? Okay. If there is a compliance issue, then please state a corrective action or why there's an issue. So maybe there's a missing protocol. You find out that in order for a self-screening to actually happen, folks need more thermometers. So then we might need to address the system or process, and you'll add that here. If it's a personnel compliance, you're gonna write that staff's name and what they're doing for non-compliance, and then write if you have a suggested corrective action. And that's for every section. So if you have any direct reports, you're responsible for completing this and emailing it to me every Friday, only if there's a suggested corrective action. If not, you don't need to email it to me. You can just save it on your folder. Does that make sense?
And we do one for each site?
Let me think about that.
For example, if I have Main Street and like Christina's saying, and 17th, should we do one for each one?
Yes.
Okay.
Yeah. Thank you for clarifying. And I'm sure other questions are going to come up because we're rolling this out. So you could go down here and you could go compliance issue. And you can say system process issue and say that this form sucks and you need better direction. You know, like that is part of what we're working on. All of these I've created in the last 2 weeks. There's a lot of moving pieces. We're going to really see what works and what doesn't work. So it's going to require all supervisors to really practice the process and let me know what's missing so we can modify it.